There is a test that takes less than 10 seconds, requires no equipment, costs nothing, and has been shown in multiple large studies to predict risk of hospitalization, cognitive decline, disability, and even mortality in adults over 60. It is not a blood test, it is not a scan, it is not a questionnaire, it is simply how fast you walk. In this video, we are going to break down exactly what the research says about walking speed, what your current pace might be telling doctors about your health, what slows it down, and most importantly, what you can actually do to improve it. This is one of the most genuinely surprising pieces of research I have come across for this channel. Here's why this topic deserves a full video. Walking speed, the specifically how fast you can walk at your normal comfortable pace across a short measured distance, is now recognized by geriatric medicine researchers as what some call the sixth vital sign, alongside blood pressure, heart rate, temperature, respiratory rate, and oxygen saturation. Walking speed is increasingly being used as a rapid clinical indicator of overall physiological health in older adults. This is not a fringe idea. A landmark meta analysis published in the Journal of the American Medical Association, which pooled data from 9 separate studies covering over 34,000 adults aged 65 and older, found that walking speed was a consistent and powerful predictor of survival. The researchers concluded that each zero point 0.1 meter per second increase in walking speed was associated with a 12% reduction in mortality risk. That is an extraordinary finding from a remarkably simple measurement. Let me walk you through what the data actually shows because the specific numbers are important here. The meta analysis I mentioned, Studenski et al., JAMA 2011, found that across all age groups studied, a walking speed of zero point 0.8 meters per second or faster was associated with longer survival than expected for age and sex. Below zero point 0.6 meters per second was associated with significantly elevated health risk. To give you a practical sense of what those numbers feel like in real life, zero point 0.8 meters per second means crossing a standard pedestrian crossing, typically about 12 to 15 meters wide, in approximately 15 to 18 seconds at a comfortable pace. Most people do not think of this as athletic. It is simply unhurried, confident walking. But large portions of the older adult population fall below this threshold without realizing it. A separate large study from the Pittsburgh Study of Usual Gait Speed, which followed older adults over many years, found that usual gait speed predicted not just mortality, but also hospitalizations, falls, cognitive decline, and loss of independence. And these are not minor outcomes. Like, these are the core things that determine quality of life in later years. The obvious question is, why does something as simple as walking speed carry so much predictive power? The answer is that walking is far more physiologically complex than most people realize. A normal walking stride requires coordinated input from multiple body systems simultaneously. Your cardiovascular system must supply adequate blood flow to working muscles. Your nervous system must coordinate hundreds of muscle activations per step with precise timing. Your muscular system must generate sufficient force through the legs, core, and trunk. Your vestibular and proprioceptive systems must maintain balance and spatial orientation. Your cognitive system, specifically executive function and attention, must oversee the entire process, particularly in any environment with variability. When any one of these systems begins to decline, whether that is muscle strength, cardiovascular capacity, nerve conduction speed, balance, or cognitive processing, walking speed tends to slow down as one of the earliest detectable signals. This is why researchers began paying attention to it. It is not that slow walking causes health problems, it is that slow walking reflects underlying physiological changes happening across multiple systems simultaneously. It is a composite readout of overall biological age in a way that a single blood test rarely is. Before we go further, let me give you a simple way to measure your own walking speed right now at home. You do not need any clinical equipment. You need a measured distance of exactly 4 meters. That is about 13 feet, a flat surface indoors or outdoors, and a phone timer. The method used in most clinical research is called the 4 meter gait speed test. Here's exactly how to do it correctly. Mark your 4 meter distance. Two pieces of tape on the floor work perfectly. Start standing still about 1 meter before the first tape mark. Begin walking at your normal, comfortable pace before you reach the first tape. This ensures you are already at your natural walking speed when you cross the start line rather than still accelerating. Stop your timer as you cross the end line. Do this 3 times and take the average. Now calculate your speed. 4 meters divided by your time in seconds equals your speed in meters per second. Reference values used in clinical research above 1.0 meters per second, generally associated with good functional health for the age group. zero point 0.8 to 1.0 meters per second, the middle zone, reasonable but worth monitoring and working to maintain or improve. Below zero point 0.8 meters per second, associated in research with elevated risk and worth discussing with your doctor. Below zero point 0.6 meters per second, associated in research with significantly elevated risk across multiple outcomes. I want to be clear. These are population level research reference ranges, not a diagnosis. Your individual health depends on many factors, but this number gives you a useful data point to track over time and to bring up with your physician. Now, let us look at what actually causes walking speed to slow down, because understanding the causes is the key to doing something about it. The research identifies several main drivers. Driver 1, muscle weakness, specifically in the legs, glutes, and core. This connects directly to what we discussed in our last video about sarcopenia. Muscle power, the ability to generate force quickly, declines with age even faster than raw strength. Walking requires repeated bursts of leg muscle power with every step, not just sustained strength. Loss of muscle power in the quadriceps, hip flexors, and calf muscles is consistently identified as one of the strongest correlates of declining gait speed. Driver 2, reduced cardiovascular efficiency. Walking at even a moderate pace is an aerobic activity. As cardiovascular fitness declines, the body cannot deliver oxygen to working muscles as efficiently, and pace slows to compensate. Driver 3, balance and proprioception decline. With age, the feedback systems that tell your brain where your body is in space become less precise. This causes unconscious slowing. As a protective strategy, the brain reduces walking speed to give itself more time to process balance demands. Driver 4, cognitive load. Research has shown that dual task walking while thinking about something else, slows down more significantly in older adults than younger ones. Executive function decline affects the attentional resources available for gait control. Driver 5, pain and joint mechanics, arthritis, hip pain, knee pain, and plantar fasciitis all directly reduce willingness and ability to take full confident strides. I want to spend some time on one of the most surprising findings in this area because it is not widely known outside of clinical research. Multiple studies have now found a significant association between walking speed and cognitive health, not just physical health. A study published in Neurology found that slower walking speed in midlife was associated with lower cognitive test scores, lower brain volume on MRI, and accelerated brain aging even in people with no diagnosed cognitive condition. The researchers followed over 900 people from birth and found that by age 45, those who would go on to have faster walking speeds in their 70s were already showing better cognitive function. A separate analysis of UK Biobank data found that slow walkers had shorter telomeres, a biological marker of cellular aging, equivalent to being biologically 16 years older than fast walkers of the same chronological age. What this means practically, improving walking speed is not only a physical health goal, it is potentially a cognitive health strategy. The interventions that improve gait speed, resistance training, balance work, cardiovascular exercise, are the same interventions most strongly associated with preserving cognitive function in older adults. These are not separate goals, they are the same goal pursued through the same means. Now, the most important section of this video, what does the research say, actually works to improve or maintain walking speed in older adults? Intervention 1, progressive resistance training. This is the most consistently effective intervention across the research literature. Specifically, exercises targeting the quadriceps, hip flexors, glutes, and calves, the primary muscle groups driving forward propulsion in walking. Studies show that 8 to 12 weeks of progressive lower body resistance training produces measurable improvements in gait speed in older adults, even starting in the 70s and 80s. The key word is progressive. The load must increase over time for the adaptation to continue. Intervention 2, power training. Because walking requires muscle power, force generated quickly, not just strength. There is growing evidence that power focused training produces even larger gait speed improvements than traditional slow resistance training. This means performing exercises with intentional speed on the lifting phase, not just moving weight slowly. Chair stands performed as quickly as safely possible are a practical example. Intervention 3, balance and proprioception work. Tai Chi, single leg standing, tandem walking, and uneven surface walking have all shown benefits for gait speed, primarily through improving the balance confidence that allows the brain to permit faster walking without triggering a protective slowdown. Intervention 4, cardiovascular training. Brisk walking itself, at a pace that elevates heart rate, improves the cardiovascular efficiency that supports faster, comfortable walking speed. The key is that it must be challenging. A stroll does not provide the training stimulus needed. One more intervention worth highlighting that most people have never heard of: dual task training. Because cognitive load is a significant contributor to walking speed decline, researchers have explored whether training people to walk while simultaneously performing cognitive tasks can improve gait speed under real world conditions, and the evidence is promising. Dual task training looks like this in practice: walking while counting backwards from 100 by sevens, walking while naming animals alphabetically, walking while carrying on a conversation about a topic that requires active thinking. These are not difficult activities individually, but combining them with walking creates a training stimulus for the attentional systems that govern gait control. Studies have found that dual task training programs produce improvements in both usual gait speed and dual task gait speed, the version tested in research settings. In older adults over 8 to 12-week programs, it is a low cost, easily accessible intervention that almost nobody is using intentionally. Here's a concrete practical plan based on the research. Step 1 this week: measure your baseline. Do the 4 meter gait speed test I described earlier. Do it 3 times, take the average, write the number down with today's date. This is your starting point. Retest every 4 weeks. Step 2, add lower body resistance work twice a week. You do not need a gym. Chair assisted squats, step ups onto a low step, calf raises, and hip hinge movements cover the primary muscles. Start with whatever you can do safely. Add repetitions or resistance gradually over weeks. So yeah, if you have access to a physiotherapist or exercise physiologist, this is worth 1 or 2 sessions to get the technique right. Step 3, add one balance challenge daily. Standing on one foot while holding a counter, 30 seconds each side. Tandem walking along a line on the floor. These take under 5 minutes and directly train the balance systems that allow your brain to permit faster walking. Step 4, add intentional walking pace work twice a week. During a normal walk, add 2 to 3 short intervals of brisker walking, fast enough that talking becomes slightly effortful, for 60 to 90 seconds at a time. This is the cardiovascular training component. Step 5, try one dual task walk per week. Pick a route you know well. While walking, count backwards from 200 by threes or name a country for every letter of the alphabet. Notice where your pace slows. Over weeks, the task becomes easier and your pace during the task improves. Gait speed testing is increasingly used in geriatric medicine, but is still not routine. In many general practice settings, if you measure your walking speed and it falls below zero point 0.8 meters per second, that is worth mentioning at your next appointment. Ask your doctor if a formal gait assessment, a physiotherapy referral, or a falls risk evaluation would be appropriate. If you are already above 1.0 meters per second, good. The goal is to maintain it. Walking speed tends to decline gradually and often imperceptibly until a threshold is crossed. Tracking it every few months gives you advance warning of changes worth addressing. The broader point of this video is that walking speed is an accessible, free, non invasive window into your overall biological health. Like the research on it is some of the strongest in geriatric medicine. And unlike most health metrics, this one is genuinely modifiable through interventions that are within most people's reach. As always, everything in this video is general educational information based on published research and is not medical advice for your specific situation. If you have mobility issues, joint pain, neurological conditions, or balance problems, please work with your doctor or physiotherapist before starting any new exercise program. Next video on health grounds, the exercise that research shows most dramatically reduces fall risk in adults over 70. And it is not what most people expect. Subscribe so you do not miss it. Drop a comment below with your 4 meter gait speed result if you test it. I would genuinely like to know. See you in the next one.